Hey everyone, welcome to another episode of Pediatrics 2.0. Today I'm really excited because I get to talk with Chip Hart. And if you are a pediatrician, you probably know his name. He's the Director of Pediatric Solutions at PCC, and he was one of the co-hosts of last year's Pediatric COVID webinars for pediatricians and primary care physicians that was hyper popular and so helpful in the midst of all of the uncertainty. And I feel like, practices have those things down now for the most part. But I wanted to have Chip on to talk about the current state of pediatrics, outpatient pediatric care, and also the future of pediatrics and outpatient care and what all of that looks like. So, Chip, it feels like everything changes all the time these days, but you have a special pulse on what pediatricians are facing right now because you work with so many offices and practices around the country. And so, at the start of the pandemic, it was like, well, how do we keep the lights on because nobody's coming in? And then, later it was like, well, there's so many people coming in right now. What do we do? And how do we handle vaccines and all? I mean, it's just like been a roller coaster on so many different levels. What at this moment in February, March, April of 2022 are pediatricians facing? What's on their minds and keeping them up at night at this moment?
That's a pretty simple question. No, I'm just kidding. You and I could talk about this for hours, but I think there are a couple things. I actually, this is going to sound absurd, but I actually have a presentation or seminar that literally addresses that question, and I'm not going to go through it at all. There are two or three items. So all I mean to say is I had like 10 slides or 20 slides with different answers, but there are two or three big ones that I come back to every day. The first one I'll talk about is practical, pragmatic. Your business has had more revolutionary moments in the last 2 years than any other period in your career, period. This has been the craziest roller coaster ride, is a perfect analogy, that I've witnessed. I've been doing this for over 30 years. The example I give is, on January 1st, 2021, the entire E&M descriptions and charting rules changed.
Right.
Which normally that we'd still be talking about it right now. That you would,
I feel like
you would have me on to talk about the. Yeah, it was over in like 3 weeks. It was the biggest thing to happen, except it happened in the middle of the really biggest thing. And so between as a practical matter, between the changes to coding, the changes to vaccination, which we're only beginning to get a sense of. I mean, the mRNA vaccines are going to change pediatrics substantially over the next 10, 20 years. Between the massive cash flow challenges that practices have faced, all of those pragmatic things, I think the one that's going to last a little bit is what it does to our workforce. Not only pediatricians themselves, but the people who work for them. I think the pandemic has made it very clear that our society depends very heavily economically on certain portions of our economy being underpaid. All the people who work for you are underpaid, and then you are underpaid as a result. And really, for years, I sit on all these pediatric practice management mailing lists, and it was always like, oh, I can't get front desk people, and no one wants to work for $11.95 anymore. No one ever wanted to work for $11.95, but you could get people to do it before. Now you can't.
Right.
And in order for you to own and run a business, you're going to have to pay people a livable wage. And it isn't $11 an hour. You're going to have to start paying people $15 or $20 an hour. However, in order to pay someone $15, $20, $25 an hour, you're going to need to be paid more for your work. And we are going to need to turn and look at the United Healthcares of the world with their billions and billions of dollars of profit, and really start having better conversations about how our healthcare model is going to work. Oh, look who I'm talking to. Someone who threw off the shackles of that. All right. But it's good for you, by the way. I think that is coming, and the sort of work that you're doing is coming. That's the pragmatic thing. I really think I think the pieces of what our friends and colleagues' businesses are built on are a little bit in danger. There's one giant thing that we all have to recognize is that the burnout and the moral damage and the intrinsic rewards for doing the work of being a pediatrician have been really, really uh, damaged.
Right.
Hard to use that word, but
Hmm.
and no one goes into pediatrics to make money. Like, it's the wrong specialty. It's too much work, and it's too difficult. It's too emotionally draining. Um, they do it because there's an intrinsic value to taking care of children. I mean, I know that's why you do this,
Right.
because it's the same reason some people choose to be school teachers. All right, no, you don't become a school teacher because it's good money. The work is too difficult. It's too much of a grind, and what it really is about making the people around you better, making our society or your community better. And when your society and your community are fighting back and telling you that what you're doing is harmful and that you're hurting people, and furthermore, to me, this is at the deep core of it, when the people around you are telling you that this core fundamental belief that you have, which can be summarized as a belief in science, isn't valid. So when you have people around you not willing or interested in making a sacrifice for a common good, which is something we all used to do, and I'd say you and I are too young, but that was, our grandparents before us certainly understood sacrificing for the common good. When you as a pediatrician no longer are surrounded by people with similar values and who are also telling you that your belief system is broken or evil, that's really, really difficult place to work. You've taken away now the intrinsic reward of being a pediatrician, and that's something we're going to suffer with. I think there are already huge swaths of the United States that don't have enough pediatricians. There are some that have too many, but most of the United States doesn't have enough coverage for kids. I do not see that getting better in the next couple of years. Who
Right.
the heck would want to do this job? Um, so there you go. That's what keeps my clients up at night, and by extension, that's what keeps me up at night. I think some of these problems are imminently solvable. They're math problems. The running your business side of it, just hard work. The other part is a little bit more emotional, and I think is really going to require to be solved. It's really going to require a broader social cultural change, and you and I aren't going to make that happen. It doesn't start here today. This is not the day that the revolution started, but it is. I will say, I do think pediatricians are going to have to be better at supporting each other
Hmm.
and understanding each other. You know this. You practice in silos. You can even be in
For
a
sure.
silo in your own practice. You,
Totally.
you know you and you need to stop. You guys are the only people who understand each other, and you have so much to give. And I think as a profession, you have so much to be proud of. And what I don't want to do is just have us get through this pandemic and just slide back into try to get back to the way things were, because that's a huge mistake.
So
Uh,
you've said a lot, and I think it encapsulates a lot of the feelings that pediatricians are having right now, especially about the not just the business side of things and staying in business, and that it's going to cost more to stay in business, because you are absolutely right that employees both want and deserve to be paid
mhm.
accordingly, and that we shouldn't just be piling on to them and expecting them to, be grateful that they have a $12 per hour job, because there's plenty of those available. Actually, there aren't that many available, because almost everyone else pays a lot more than that,
Right.
even for extremely entry level, not even high school degree work. And so that's going to be part of it. But then I think you're absolutely right that there's not just the business side of things, but there's also the feeling like you're making a difference. And before it was easy to feel that way, and now it's been amplified that there are a lot of people out there that say, no, you're not making a difference. You're evil. You're doing things that are harming my child and society, and all those things that pediatricians are now facing and having to wonder as they walk into the exam room or go to the grocery store. Those were all times where before it was, you felt good because people recognized you, and now you don't want to be recognized.
It's
It's
dangerous.
hard.
I have clients who've been
Yeah,
picketed for giving
totally.
COVID vaccines, and they look out the window and say that crazy person with a megaphone is one of my patient moms. Like, and I pediatricians are not wired to deal with that kind of conflict. You like to
No,
play with kids, and
right.
I think it hurts. It hurts really deeply, and we're just starting to just starting to have the discussions about what that means, what it means to be a pediatrician. And personally, I think that those discussions can't happen soon enough. We may find, I've already seen it a little bit, but we may find that there are some pediatricians who say, you know what, I'm in the wrong business, or I'm doing this wrong and
Mm.
I need to get out of it. And that's sad, but I would rather have someone realize what they should be doing and do the right thing. And I hope, though, for the majority of people who are left, that we're able to support each other and make the work more meaningful. I mean, I know your personal journey has been about how do I make this work more meaningful, and how do I have a bigger impact on my patients, and I think that's the most important work you can do as a pediatrician. If you're not feeling fulfilled by your work and your career and you're a pediatrician, then something's really, really wrong.
Amen.
You do such important work, and if you're not feeling it, then something is broken. And there are a lot of people who are feeling broken. I've had more clients cry to me in person or on the phone in the last year than, pick any decade of time before this. It's an almost daily occurrence, and
Well,
that horrifies me.
I can definitely see that in my colleagues and people around the country that I have the opportunity to talk with too. That there's a lot of burnout and damage that's been done in the past 2 years,
Mhm.
and finding fulfillment is all the more important when you're
Yeah.
up against those things. So it's an even more critical time to say I feel fulfilled in my work despite these different things that are going on in society
Uh-huh.
that I have no control over that affect me, and my sleep at night. It's a hard time to be a pediatrician. Let's
Yeah.
talk. Let's talk from back to the business side of things. What should pediatricians be focusing their attention on right now in the first half of 2022 to best position themselves to be, business wise successful in 2022 and beyond? What are the things that, tactical, practical sorts of things
Mhm.
should we be doing to make sure that we're ready for whatever 2022 and 2023 and 2028 hold for us?
So my answer to that question has not changed in 25 years. However, I am going to augment it slightly as a result of the pandemic. First of all, it's always been in pediatrics, focusing on preventive care and recall. Period. It's
Mm-hmm.
like if I could give one lecture for the rest of my life, it would be recall, recall, recall. It is your distinctive competency as pediatricians. It's the most important work you do clinically. I could give you 15 reasons why the thing you need to focus on is recall. I just worked with a practice today. Call me up. This is like literally just before we got on this call. Chip, our revenue is down, which is a little weird in 2022, no, 21, because those are the busiest months in pediatric
Mm-hmm.
history. Okay, our revenue is down, and we want to do some. I want to look at some stuff, and I call in, and I'm like, "Do you know that your little practice has more than 1,500 active kids who are overdue for well visits
Yeah.
during COVID?" That's what you need to work on. So, my first answer is always recall. It's where, oh my gosh, I mean, the list of reasons I can give is immense, but you're being measured on it already. It is good is good for you from a revenue perspective.
Right.
It's the only way you keep your appointment book full. The discipline of being good at preventive care, and by that I also do mean chronic disease management. Managing kids with mental health needs and so forth. Like it's more than just well visits, but well visits at the top of the list. Anyway, the discipline to do those things well is the same discipline that it takes to run the business properly. I will tell you, because I measure these things, we benchmark our clients. Our clients who score highest in the clinical measures also score highest in the financial measures.
Right.
Always. It's like really highly correlated. I think I may have said this already, but you're already being measured on it as a quality measure. There's massive evidence now that this is the impact you have doing this preventive care work saves us billions of dollars in the future. Every kid you keep from smoking, every kid, you might fail 99 times, but you keep one kid from becoming obese, and you've changed that family's life. Totally. And the big reason is it's because it's what's good for the patients. I mean, one of the things that's funny about medicine is that when you're the physician, not the hospital and not the healthcare system, but when you're the physician, when you do the right thing for the patients, everything else is easy. Everything else, the money takes care of itself, the patients take care of themselves. So anyway, my answer is always recall. My second answer, though, this is the only thing I've changed in the last 25 years, and that is everyone who is in business watching this call, or watching us too. You need to know what's going on with your cash flow. Okay. I used to not have to say that because cash flow was so consistent, but I mean, you know this. And we were 2 weeks into COVID, and I was getting phone calls about practices having to lay people off. Right. I know people locally here in town. I know orthopedic surgeons here in town who had to lay off their entire staff after about 30 days. And I'm sitting here saying, you are in the highest legal cash flow profession there is. Right. Okay. And your business couldn't handle 2 weeks of no cash.
Right.
What have you been doing with what have you been doing? What have you been doing with it? And so right now it's funny. So then what happens is we get on the roller coaster. Everyone freaks out. And I remember April 2020, everyone saying, please God, we will do anything to get back to where we were. And then all of a sudden, even in October 2020, the volume was already back up. But October, August, September, October 2021 were the busiest months in pediatric history. And then everyone's like, okay, you answered my prayers, but I didn't really mean it.
Right. Turn it back down now.
So they're sitting on all this cash, and most people listening got money from the government.
Right.
Some people got a lot of money from the government. And what did they do? They just distributed it to the partners.
Right.
And I'm like, guys, did you not learn a single lesson from this? You need to go turn around and look at your infrastructure. You need to pay your staff so that they are going to be with you the whole time. I had some clients who were very aggressive about keeping their staff employed the entire time, even if they didn't come into work. And they rebounded like so much better than everyone else because they had no problem. So that money needs to go to your staff. That needs to go to your infrastructure. You need to have a cash surplus in case this happens again. And here's the big one. This came out at the PMI conference last week. Someone raised a hand and said, "My doctors are burning out. What do I do?" And people are coming up with all kinds of answers. And I said, "Well, look." They said, how do I see fewer patients? And I said, you're in the service business. Your patient flow isn't entirely up to you. All right. You can do things to mitigate it, but it's not a faucet you can just turn off and turn on and expect everything to work okay. So I said, look, right now the fire hose is on. At least take the money that you're generating right now and invest it in things in your practice to make doing that work easier. Buy the EHR you've always wanted. Go get a scribe. Get a better laptop. Go fix your wireless and get a better internet connection. I'm just naming all the nerdy stuff that I work on. Like whatever aspect of your practice that isn't bringing you joy, take the benefit of all your hard work right now and make your nest nicer. Make it an
Totally.
easier
Oh,
place
that's such. I mean, the scribe is a huge one that I think I've tried to talk, and I brought in scribes at my previous practice,
Yep.
and it made such a difference. And I would have friends that are physicians that brought their kids in to see me, and they were in a different
Yep.
specialty, and I was like, "Here's how you roll into a scribe, and why do you not have a scribe? Because you're a surgeon, and your cash flow and revenue is much higher. You can afford a scribe.
Oh
If I
my
can
God.
afford a scribe."
Why, yeah, yeah, if you can
And
afford a
there's no
scribe.
reason to not, especially if you have all this
Yep.
cash on hand or you're not sure what to do with it. I love that you say, take care of your employees. Don't just push that cash right out to the partners while you still have huge employee turnover and employee dissatisfaction. Show
Mm-hmm.
that you care, that they have been busting their asses for the past 2 years as well, and doing a lot of the grunt work and exposing themselves to both the medical risk and the financial risk and all those different things. Take care of your employees and they will take care of you. And then invest in your system too, because what you said about recall, well, what if recall was easier? What if we didn't have to, remind patients or,
Uh-huh.
generate lists? What if we could just have a text message service that texted them and said, "Hey, it's been 3 months. You're probably due for a checkup.
Yep.
Click this link to schedule your appointment." Like, those are things that are possible, but they take a little investment. And if you want to recall patients, and it's going to be worth your while, every penny that you could spend on creating those systems, then you don't have to do it, and you don't have to remember or say, "Oh
Right.
my gosh, look at all these patients that were due for their 15-month checkup that we missed, and now they're here for their 18-month checkup, and we just lost that revenue forever for them."
Yep.
Invest in those things.
That's exactly it. Everything you just said are things words that have come out of my mouth in the past. And it doesn't have to be. You don't have to have the final solution today. Like a really dumb, easy example. Okay, maybe your EHR doesn't have a recall system, or maybe it's going to take you got to sign all these documents to get the texting thing working, or maybe texting does only covers half your patients. I don't care. Go hire someone, pay
Right.
20 bucks or pay someone 25 bucks an hour, give them a list of 500 names, say call these people and book appointments. You book one well visit every hour. If that person calls 20 people, if that person like literally bats 050,
Right.
okay, like like the worst batting average in history, they still more than pay for themselves.
Totally.
And when you get when people get back into your queue, your well visit queue, that's how you reestablish your primacy in your community as the trusted voice of science.
Right.
When they get in front of you, they turn off the TV, Facebook is off, and you're actually looking at them and saying, "Okay, I'm actually the person who went to med school and studied this, and
Right.
these vaccines are not harmful. This is how we stay safe." That's how you get back in front of them. And it literally just takes a little bit of willpower to do. It doesn't take being fancy. Being fancy and nerdy is like, I love
Right.
it.
I love like a good,
Yeah.
automated text message and link where I don't
Yeah.
have to touch it. But,
Totally.
I had my scribe when a new baby came in. My scribe, before they left, they got a little card that had, the information for our website and everything like that. And then it had their 2 month, their 1 month, and their 2 week, their 1 month, and their 2 month visits when they're coming in, because most of them were on maternity leave. Their schedule was wide open. You don't even have to say, "Are you busy?" Two
I do
Wednesdays
not
from now.
understand. I don't
Like,
understand why
so
pediatricians do not lock all those in. You should be
yep,
locking
they
out
were
the
locked
first
in.
year.
And nobody ever was like, "Oh,
Yes.
this," like maybe 1 in 100 would say, "This date doesn't work for me." Okay, well, let's find a
Then you
different
say,
date.
okay.
But even then, if
I'm
they're
glad
already
you're
on the
standing
schedule,
in front of
right?
you. Yeah, you're
Yeah,
standing in front of me. They all have. I'm missing my phone. They all have a phone. They're
right.
gonna look at their calendar while they're talking to you.
That's why the dentists
I
are so
did.
good at that. Like the dentists, like I get if I haven't scheduled, like, "Oh yeah, 2 years from now I have a dental checkup on the books," because they're all about it. Because it's much easier. Like if it's on the books, like, okay, well, I
Yes.
guess I'll go to the dentist. I must have scheduled that at some point when I thought it was a good idea.
If you want to know how to run a practice properly, look at what the dentists and the veterinarians do.
Right.
Okay, and the reason is those businesses depend on work that isn't acute. You don't have to get your teeth cleaned.
Right.
Okay, you should. In fact, we have all growing evidence that says if your teeth are not clean, it actually harms your brain and your heart. I mean, you know this, all right? So,
Right.
like, you really should be. It is that important. Well, we treat well visits are also still not at the forefront of parents' minds of saying, "Oh no, it's more important that I go to that 3-year-old than I go in for an ear thing," because
Right.
you're not really doing much at anything.
Right.
I mean, you're just reassuring them. And that 3-year-old visit is so much more important. Now, I couldn't agree with you more. And I actually did the work. I grabbed the data for, I'm trying to remember how much data was. It is the equivalent of millions of visits, okay, pediatric visits. And our clients who schedule out farther have a higher well visit coverage rate, period.
Oh, I'm sure.
All right. And the evidence is there. And I just tell pediatricians all the time, if you have a kid who's over the age of 3 who walks out of your office without knowing when their next appointment is, notice I said walks out of your office. I didn't say walks out of your office at a well visit. I'm saying every time they come in, could be for a sprained ankle or a rash, doesn't matter. Every time they leave your office, they need in hand or on their phone the date of their next appointment. And if they don't know it, that means you as a clinician are willing to accept that there's a higher chance that they won't come in when they're supposed to for their next well visit. You're saying I'm going to compromise. It's okay. They don't need to come in. And that's not the place to make a compromise. So I could not agree with you more. Book them all, get them in. It's easy. And your patients like it.
And they love coming. Like you coming in for a checkup is like fun for parents, and they just get it's like a boost of dopamine because they're growing nicely, they're developing nicely. Like parents want to hear those things, but it's easy to put it off if nobody's reminding you, and you don't already have it on the calendar to do that. And I think that when you say you can come in next year, or some practices I know do like every 2 years for visits, which is just like. My level of importance is so low that if you come in 2 years or 3, it's fine. It's not a big deal. Whenever
you've just told them that you're a health clinic.
Right.
Come in if something is on fire.
Right. Exactly.
And that is not what you do. Oh, and then they're stunned when the local minute clinic starts eating their lunch.
Totally.
Oh, and by the way, we're only open from 9 to 4:30. That's the other one.
Right.
Where I'm like, are you really like when you're working? So. The only time you're ever going to see me if your kid is so sick that you can't go to work.
Right.
And then you're going to call me for an appointment. And then all the other things that happen in your child's life, you'll be all right.
Yeah.
That's just the wrong. That's
it'd be like if Jiffy Lube was like. It'd be like if Jiffy Lube was like, come back in 3,000 miles. Or 6,000, it's whatever.
Right.
Whatever.
Best. Yeah, and you don't.
Right.
That's the thing.
until you're like, I don't think I got my oil changed this decade. I probably can explain why my car is on fire right now.
Right, and that's being a parent. That's the other thing. By acknowledging the importance of well visits, we are acknowledging how difficult it is to be a parent. It is really hard to be a parent. And one of the things that you lose as a parent is objectivity. You're so close. You are in the weeds of whatever challenges you have with your family. And I mean, one thing I don't know, I haven't figured out in all my years of doing this, is my career doing this. I can't figure out how to talk like this without it sounding like I'm lecturing you when you already know all this. So I'm lecturing the audience. They all know all this, but it's like when you're a parent, you're so close to the problem. And what they need sometimes is you, with your objectivity, to step back and say, hey, I just want you to know these things, you're kicking butt. Don't worry about it. Right. These are normal. You keep it. This here could go in a couple different ways. Let me give you a couple ideas. And this thing I'm worried about, and I want you to take all the energy that you're devoting to this stuff and slide that into this one. I mean, you know this. And they don't get that without you. And worse, I think it's actually worse now because so much parenting advice comes from social media, which is maybe the worst source of human advice in the history of mankind. It's horrifying.
Amen.
So I just, anyway, you asked me the question, the 2 things you need to be doing: patient recall, well visits, and keep an eye on your cash flow. Okay. There's my 5-second summary of a 10-minute answer.
No, that was a really good answer that I think just goes into a lot of the things that it can be hard to know, where to focus your time. But I know that you've said this a million times before about recall, and so I'm glad for that reminder that recall is important. And the thing that I would add is make it as easy as humanly possible to get them to schedule the appointment. If you text them and say, hey, you need an appointment, call our office. Well, that's okay. I mean, that's something. But if they have to then call and wait on hold, and gosh, it always takes 20 minutes on hold, that's challenging. Versus, hey, here's the link to schedule the appointment, which would be ideal because then they don't never have to call because no one likes to talk on the phone. And they can look at their calendar and find that. And then the in between of those would be if you pay your staff to look at your calendar and say, hey, you're due for your 15-month checkup. Does Thursday at 9 a.m. work? And then they message that to the patient. And then the patient just has to say, yes, that works, or no, that doesn't work. And even if you only get 50% of them that works, then you've already taken that load off and you're getting those patients rescheduled in an easy way.
Yep, absolutely. And every time you do that, an angel gets his wings or her wings, because you're actually incrementally saving a child's life every time you do a well visit. It's a very, very small amount. It's one little pebble. But also the cash register rings.
Right.
And so, yes. Anyway, I could talk about that subject forever. So let's.
Oh, I love patient recall. I love the tech component of it too. We could nerd out on that forever. But I want to think now. We're thinking bigger picture. Next 5 years. Right. What, in terms of practice innovation, marketing strategies, we're out of the pandemic. We don't have any more pandemics for a while, or masks, or all those different things that we've been hyper focused on for the past 2 years. What's the 5-year outlook for pediatrics in terms of what pediatricians that are trying to forecast a little bit further out need to be looking at and thinking about?
Oh, this is tricky because I know some of these things are going to be true, and there are other parts that are outside our scope of control and understanding. And so,
sure,
like if you had asked me this question, like literally 24 months ago, like right now, right? Would we? The first thing I'm going to tell you is there's been one enormous revolutionary change in pediatrics that everyone's already forgotten about. Like, we don't even talk about it. It's gigantic. If you had asked me literally 24 months ago, February 2020, 3 weeks, well, right now this would be 5 weeks before COVID really hits. It was already in the news, all right, but it hadn't hit until March 13th. If you had said to me, Chip, by April 1st, did you know that more than half of all sick visits performed on children in the United States would be done using telemedicine?
Right.
I would have said, no, you're lying. All right. Right now, the running number as of like a week or two ago among our clients, it's about, I'm saying this from memory, 10 to 15% of all sick visits are still done via telemedicine. If you had said 2 years ago, 10% of all your visits will be telemedicine, we would have had a year's worth of seminars about it, because it was oh my gosh, how are we going to do this? Like, and yet right now no one even talks about it right now. It's not even an issue. And the thing is, so COVID shows up, people do parking lot visits, which for those of us in like Vermont and North Dakota is a totally different challenge than those people in the South, right?
With the parka.
We only have a few months. Yeah, we have that only works for a few months of the year.
It's like, when the doctor's like, oh, the stethoscope's so cold in the exam, you're like, oh, it's a cold stethoscope because it's at room temperature at 70 degrees versus like negative 20.
Yeah, exactly. And so we had to change gears, and we did it, but I'm not aware of any real standard of care or good guidance or first of all, I feel like the clinical aspect of doing telemedicine really needs to be figured out over the next 5 years. Can we do well visits via telemedicine? What can we do via telemedicine? What can't we do? And you know this, I don't have to tell you, there are some things for which telemedicine is even arguably better, all right, for a lot of reasons. All right.
The one that in October in 2019, I did my first telemedicine visit in October of 2019, and I did it for free
Yep.
because I knew insurance wouldn't pay me. But I wanted to see if I could figure out the infrastructure, and gosh, it worked out well that I like played around with it, 5 months in advance.
Yep.
But I wanted to do an ADHD visit from the parking lot at school so that the kid wouldn't have to miss, leaving school, driving to the office, waiting in the waiting room, 20-minute
Yep.
visit. Got to get lunch because we missed lunch. Back to school, 4 hours later. Well, I just want to try this. I'm not going to charge you for it because it's not going to, insurance won't pay for it, but I just want to
Yeah.
see if it can work. And I mean, it was better than an in-office visit because it
It's better,
saved the
better for
child who's
you.
already having
Yeah.
trouble in school from having to leave school for
That's
four
right.
hours to come to see me.
Right. What part of the prescription for a kid with ADHD is to pull them out of class, make them wait in a waiting room? Like it was like
Exactly.
it's the worst thing you could do. And yeah, everything about it is better. So we haven't really gotten our heads around the clinical understanding. That's the first part. We haven't really gotten our heads around the technical understanding. I mean, right now, there are plenty of platforms. There are literally
Sure.
hundreds of platforms you can do this on. I don't think we have a clear winner right now. I have clients who like. I've got some clients who like a little bit of everything. Some like a very intense embedded telemedicine solution. Some like the lightest thing they can do. Should this be in a circumstance like you and I are on right now, with we've got lights and a microphone, or should I be able to do it on my telephone all the time? And we also know from a infrastructure perspective, telemedicine works really well for most of your patients, but we may be continuing to exclude a subset of them, and we don't
Sure.
want to do that. So we've got to solve that problem. And last but not least, in fact, arguably first and foremost, we got to solve the payment problem on this. Am I allowed to swear on your podcast? Am I
Sure.
allowed to? All right. The fact that the insurance companies did not race to the front of the line and say incentivize you to do telemedicine was bullshit. All right. That's criminal, and it's borderline. It's like organized crime. All right. It saved them money, and it saved lives. And meanwhile, these guys are collecting premiums
Right.
from March through October, and visit volume was at its nadir. They're still getting paid. Why could they not? Why can they not accept telemedicine visits as standard? What are they afraid you're going to do?
Right.
What, like,
Well, it's because they don't have
how?
to. Like they didn't have to. Like
Right.
there
Of
was no
course,
reason for
that's
them to
why.
do it because there's no reason for them to do it.
Yeah, and that to me is it's beyond, it's unethical, and it borders on criminal. And I think you ought to be paid for your time, and I think you ought to be paid for your expertise, and you also ought to be paid for your availability. And let's be clear, pediatricians have been providing free telemedicine forever.
Oh, for
All
sure.
right, and that those days have got to be done. I would love to see the pediatricians en masse stand up and say, "We're done. We are getting paid to take these calls at night. We're getting paid to do telemedicine, and you all have healthcare insurance. And we are such a teeny, tiny, little budget dust part of every one of these insurance companies' budget. Hey, why don't you throw us just a little bit, and we'll keep your kids out of the ER."
Right. That
And
would be worth it if they consider that, like if you would pay for those after hours care, how much they would save in unnecessary ER visits.
They know.
Right.
They know,
It's just
'cause what
but
they
we're going to do it anyways, so why would we do that? Cuz you're going to do it
Yep.
no matter what anyways. And
Right.
if they can't get a hold of you through your answering service, they'll just call your personal cell phone or something like that,
Yeah.
because pediatricians are nice like that. And so there's no
Right.
incentive on the insurance company side to do that.
As long as we to be clear, I'm not a single payer advocate. I think there are problems with that model, but most of the arguments against it, I think, are just nonsensical. As long as we have a three-party system, patient, doctor, and anyone else paying the bill, it's this kind of baloney is always going to happen.
Right.
Always. All right. And so it's very frustrating to me. So anyway, over the next 5 years, the thing that I think could have the most profound effect on pediatrics is telemedicine. The second most important thing in pediatrics, you ready here? This is my prediction. We'll see if in a couple of years people say, "Wow, he was really smart." It's unlikely because that hasn't happened yet. But um, right now that there are over 50 mRNA vaccines in studies or in study phase, specifically targeting various cancers.
Mm-hmm.
Okay, there are the revolutionary impact of the COVID vaccine, getting the mRNA in front of as being sort of the new way that we approach vaccination, um, has such that portends to have the biggest impact on you as a pediatrician. The reason I say that is, okay, just imagine for a moment, because this is maybe part of the science fiction that's being constructed here. Imagine for a moment that in 5 years or 10 years, instead of 25 or whatever the number is, 30 different vector shots that you give over the course of a couple of years. What if you gave one shot at one shot at two, and one shot at five, and every one of
Wow.
those shots had 40 components? That is the sort of thing that is coming. And what if you started being able to vaccinate for cancer? You already do, right? You're
Right.
the only profession you do HPV. Like
Right.
you're the only profession that prevents cancer. Remember, almost the entire rest of healthcare depends on cancer to stay in business. You're the only people out front. And yes, I realize a couple of the other specialties flirt with it, but come on, who gives the HPV vaccine? You do.
Right.
All
Right.
right. So you are literally trying to put the hospitals out of business. Well, what happens if you guys, all of a sudden these cancer vaccines come along and we are somehow able to cut the cancer diagnosis? What if we cut them in half? And it might take 5, 10, 20 years.
Right.
But what are the hospitals going to do? They're going to freak out. And they're going to come try to. They're going to. The impact of that means they're going to be. You are threatening their livelihoods as opposed to actually supporting their missions. Which a hospital's mission should be to put itself out of business. We make our community so healthy that we don't need to be here. That is not how they work. And
No.
so anyway, I really think, ironically, I don't know if that's a word here, but I probably is. That ironically, one of the impacts of COVID is that the pediatricians are going to be, or I really hope they become, the source of all preventive care, which includes at the forefront of it, you are the vaccine centers of the United States. Now, you already are,
Right.
but you're not
Right.
getting credit for it. And with that, what I hope sort of follows in behind that, okay? So what I'm trying to say is I do think there's potential for revolutionary change in the space as it relates to vaccines. But then the next part of that is all of the other preventive care and screening tools, such as, take your pick, Chattis or
Right.
just doing MChats or BH, like all of vision screening, hearing screening, behavioral screening, depression screening, all of those automated screening processes. I'm hoping those will get automated. All right. And I'm going to one last place. So the name of your podcast is Pediatrics 2.0, right?
Mm-hmm.
Right. So I'm hoping that what we're going to see, or actually, I don't hope, I know this will be true. This is all part of this sort of automated aspect of our healthcare in a good way. I think what we're going to see more of is what I'll call EHR 2.0. So just like the web, you had Web 1.0. The web is out there. People, the websites create content, and you go to those websites to see that content. Web 2.0, where we are right now, is where the users create the content. That created the monster called social media, but that was, you're able to put your own music up. Websites are just places where people can fill in the content. I'm hoping that EHRs in the next couple of years will be evolving into the EHR 2.0 concept, where your patients are filling in their chart notes through, not only before their office visits, but perhaps during the week or between those very important well visits. And you, as the clinician, are sort of like a shepherd keeping an eye on your flock. And you're like, oh, that's interesting. That person's smartwatch is telling me something's happening here that they don't really understand, but I do, or I at least can communicate with them. Oh, I'm
Right.
glad that this journaling process that someone is following is keeping me in touch in this very light and automated way as opposed to every once a year, I finally get to talk to this patient in this 15-minute time frame. I think that's where we're going, where the patients are going to be much more contributory to their own health records.
I
Um,
love that. That's such a great concept. I think that that will make a huge difference, and it will allow us to, you know, it could revolutionize patient recall too, because if they're providing these pings of information, then one thing that I've tried to do in my new practice is schedule, the automatic PHQ-9 pushing out to
yep. Yep.
teens and young adults. Well, why couldn't we just push that out 3 or 4 times per year to take a pulse on where teens are at, and maybe we'd catch them before their summer physical and see what they need, or get them in sooner, or be reassured that they're doing well despite all the things that are going on. And so if patients can have more, I love that idea of EHR 2.0 that has some patient-facing information gathering,
Yep.
and that it's not just you wait till they come in and then, oh my gosh, look at all these things that are going on. And I think you could probably integrate that into collect information from different places, so they go pick up their prescription at Walgreens that was from their, I'm just thinking about adult doctors now,
Yep.
from their rheumatologist, and it flows onto there, so that as the primary care you can see that without, oh, what medication are you on? Oh, let's call their
Yep.
office. Oh, they're at lunch. Let's call the pharmacy to try and figure out what this medication is. Like, those things should be connectable.
And that's your expertise, is being able to look at all these disparate things and saying, I've got a prescription here, a referral here, some information here. They gave me a little bit of data. Like, you as a physician, you can look at that, and without even trying, you can say, here's what we're going to do next. Whereas I can tell you as a parent or managing my own health, I'm like, I don't even know what to do next. Like, I
Right.
don't know what's, and that's where I think your skill set is going to be. And I'd like to see it there. I will tell you, let me give you a little insight. I say this as, I work for an EHR vendor. I spend a lot of time trying to understand interface. So we all agree, everyone can raise their hands, the interface, using an EHR sucks, okay? It
Right.
just does. And it's always going to suck because the EHRs aren't designed for you. They're designed for chart audits, and they're designed for quality reporting. They have nothing to do with actual clinical continuity, all right? Actually, no, there are some out there. Actually, I'm pretty sure those of you who are in the direct care world actually get to work with some EHRs that are designed for the doctors, because they don't have to please anyone else. It's believe me, those of us on this side of the fence dream about that. All right, just like because
I was going to say, I feel like in the past 6 weeks, my charting has gotten much more useful and relevant, without
because
having
it's
to worry
designed
about.
for you.
Yeah,
Right?
it's literally just designed for me, as a solo
Yep.
pediatrician. Like, I don't have to, I can make sure that it relays the important information so that I don't forget, and for,
Right.
legal purposes. But that's about what it's for.
Yeah. Because I've tried to explain to people, PCC could write an EHR that is actually what pediatricians want, but we would never sell it because that you can't use it. You need to
Right.
submit claims, and as soon as you are attaching CPT codes to your work, then now you've just tripled the length of your chart note. But anyway, my point was this: EHR vendors have all this experience creating code and user design for doctors. And one of the things that's going to make this tricky is we're now going to ask EHR vendors to create user interfaces for families and patients. And in some ways it's easier. In some ways it's a lot easier. But in other ways it's really tricky. And you know this. I don't know how many patient portals you've tried and played with, but a lot of them are horrifying.
Totally.
A lot of them are horrifying. And what we need to do is, what you're going to find is, you're going to find all these third-party companies who are good at writing interfaces for patients, but they don't have any business doing the work on the back end. And so you have these vendors who have the back end who have no business writing the front end. And it's just, that's going to be an interesting dynamic for a couple of years. You're inevitably, I'm saying the listener as a physician, you are going to see an interface somewhere that is like your virtual waiting room. And it has all the things that you're talking about. Oh, it pushes the PHQ-9 to these kids at these dates. And it's all this, they when they pull in their car, it detects their phone, and it rooms them automatically. I mean, I know people who do this now. They pull in, they say, we're here, and they text them a thing, walk right in and go to room 12. All right. So they don't even have to do that anymore. that's what everyone wants, but it's it's so much harder to do than people think, and
Right.
everyone's gonna have to get involved to do it right, and that's my 2 cents there.
I love that. I think that is a fine looking future to look forward to, is those things playing together nicely. And it
Yep.
it will hopefully allow pediatricians and their staff to focus on the patient more and less
Yes.
on the clicks and all of the different things that go into, the human touches that are unnecessary but necessary at this point in order for a cohesive documentation process to happen, that we should be able to get to that point where those things fly into the appropriate places. And you could, even as I'm thinking about this, like a patient's coming in for a sick visit later today. Well, what if it pushed them out a couple questions? Hey, how long has it been going on for? What have you tried already? Have you been exposed to COVID? Like, those are little pieces that could then fly back into the chart and then be in that note for documentation to be good, and also to have a little heads up on what they're coming in for, and what we're going to need to do for them.
Yep. I have clients who do that right now. Exactly
Yeah,
what you're
I do
describing.
that right now
And
already. I mean, I
yeah,
already do that with
it's
my
like,
EHR and everything
yeah.
like that. Like, we already do that, but yeah.
It's a game changer. I'll tell you, actually, we bring our kids to the office that Joe Hagan started. I mean, Joe Hagan was my kid's doctor. He
Hmm.
just recently retired. Um, Joe Hagan being one of the editors of Bright Futures, and
Right.
long before, and he was our first client back in the '80s. Okay, there are people actually listening to this show who weren't yet born. Okay, but back in 1983, he was our first client, and he's right here in this town. So my mom was a school nurse, so I've known him forever, and I've seen with my own two eyes. He did this before you could even really computerize the concept that you're talking about. Okay, I've seen, as both the vendor and the parent in the exam room, the benefit of organizing your workflow exactly the way you described it. And he did it before you could text someone a questionnaire. He just had it so that when you walked into his office, you got a little clipboard. You went into the
Right.
exam room and you answered the Bright Futures questions. And if you wanted to slip other things in there, like a PHQ or right now all the COVID protocols, you would get that stuff before you saw the doctor. And
Right.
when you were done, well, he could waltz in. He was the one who taught me this. And there are actually a couple different digitized, automated, computer driven solutions that use these concepts. All right, it's not just Chattis, it's Camzy and a few others, where literally the whole point is, look, at a well visit, I don't have an hour and a half. You might in your practice have an hour and a half, but most pediatricians don't have an hour and a half. And there's nothing worse, than going into a 7-year-old well visit, having it go well, and you've got your hand on the doorknob, and the mom says, well, or by the way, and you're like, oh. And if you had only told me this at the beginning, we
Right.
wouldn't have wasted 20 minutes. And so the tools that Dr. Hagen used, and I don't want to say he pioneered them, because who knows, someone else probably did. But as far as I know, he was the pioneer of them. Um, by asking patients before they come to your office, what are the 3 things you want to talk about today? You waltz into that room looking like a genius because you've got your list right here. I see you want to talk about the encapresis, the sleep time, and something else. Let's go. This is what
Right.
I do. As
Right.
opposed to having to fart around and finally wrest it out of them.
Right.
Oh, this is anyway. So that
Well, it
just
also shows the parent that you're like, I get what you're here for. It's,
yes,
you don't
I don't
really
want to
want me
waste
to
your time.
lecture you about like calcium for your
Right?
teenager or something like that.
Yeah.
You want to talk about how you're worried that they're depressed, and then that isn't the last thing that comes up at the end of the visit. It's what the framework for the whole visit is based around, is building
Yes.
rapport, getting into it seems like you've been perhaps feeling down a little bit. Like, if you can tailor the visit to that, then it's better for the patient, the parent,
Better
and
for
the
everyone.
physician. Yeah, everyone wins.
Yeah, and you don't have to. You don't have to be a tech whiz to do this. I'm saying just the thinking about this as a systemic process and putting those pieces into place, that's the kind of thinking I want people to do. It will lead us to, well, a computer can do that, of course. But if you're not thinking about your practice, I'm going to say this to the pediatricians. If you go into your office tomorrow and you see patients and you are surprised at every time you open that door, like, it's pediatric roulette. What am I getting? Then you're doing it wrong.
Right.
All right. And if the only clue that you have about what you're about to see is 20 characters on your appointment screen, like, if it says
Fever.
6Y, yeah, or no, headache. It says
Yeah.
headache.
Right.
Yeah, that's the room that you don't want to you don't want to open that door.
Right.
No, start thinking systemically, and how do I make this headache visit better for the patient and better for me?
Totally.
Anyway,
and those things are possible if you think about it, because how could I make a headache visit better? Well, if I got a couple key informations, is how long has it been going on? What time of day does it happen? A couple of red flag sort of things that I want to make sure that it's not a brain tumor. If I could have those things, then I can walk in knowing, okay, here's the most likely thing that we're going to face with this appointment, rather than, oh my gosh, it could be a headache, they could be depressed, they could have a brain tumor, they could have all these different things. You can eliminate those with just a few key questions. So I love that idea of just like, what's the system that could work? Well, start with what the pain point is, and then figure out a system that solves that pain point, and then you can jazz it up and electronicize it and all those different things.
Yep. And right now, most of you are sitting on, over the last 6 months, have been sitting on more cash than you've ever seen. Now's the time to make those investments.
Right.
And frankly, all the tools are there. You've got all the AAP documentation. You've got 2 or 3 other. I don't know if you care if I name people or not, but you've got all these other sorts. You've got all the Barton Schmidt and Clear Triage documents, or it doesn't matter who it is. Okay, those things exist, and you can pay money and you can get them hooked up with your EHR, but you don't even have to do that. Right now, you can literally just pay a clinical person.
Right.
To go through the calls that came in and say, hey, this headache call came in. Tell the mom that, yes, we got an appointment for you tomorrow, but nurse so-and-so is going to call you in about 20 minutes. The nurse gets in there and says, hey, first of all, I want you to go to our website. There's an article there about headaches. I just want you to read it because you might see something in there that will trigger a thought.
Yeah.
Number 2, I've got 5 questions for you. Here they are, here, and here. All right, because I want to prepare for this visit tomorrow. We can really focus better if we get this stuff in advance. And you know what? Oh, you can't talk right now? I'm going to send it to you. I'll email it to you because you can, or I'm going to put it in the portal. That's better.
Right.
If you could just do that, just pay someone. Pay someone to do that. It's not hard.
Well, this dovetails in perfectly with the last question that I had for you, which a lot of pediatricians right now are, as we've talked about, burnt out and exhausted and feeling like, how can I keep doing this? And a lot I know that I've talked with are considering scaling back in terms of their hours or their appointments or their availability or going part-time or those sorts of things. And I think that's just the knee-jerk reaction to, I can't do this anymore. But something like that is a great strategy right there for making your clinical day easier. You're making your appointment times better. Are there any other kind of top level things? We talked about scribes too, which I am just the biggest scribe fanatic that you'll meet, and I try and convince every physician that they should have scribe.
I'm totally with you. I don't understand why you all don't have scribes.
I don't understand
every scribe
it either.
Company. I hope to see a scribe ad at the Super Bowl on Super Bowl.
Oh my gosh, they would do so well. What I do, and this will be an aside, and then I want to hear your thoughts too. Is for scribes. What I did was I reached out to our university, our local university, and said, you got pre-health students, we got pre-health opportunities in our office for scribes, and we're going to pay you for that. And it's amazing. And the 3 scribes that I've had have all been, gap year students who had a year between starting or finishing undergrad and starting medical school, or they were in the process of applying. Their schedule was wide open. They could come and get paid and learn and interact with patients. And they turned out to be the most fantastic medical students because walking into medical school, they had 4,000 to 12,000 visits that they saw with me during that time period before they even walked into the door. And one of my first scribe would say, hey, do you think that kid might have autism? And I'm like, yes, totally. Like, you picked that out just because you've seen enough kids as a scribe standing in the corner documenting,
and you do
to
not
say
learn
you guess that.
anything like that. You'd learn none of that in med school. You get to it in residency. And even then in residency, it's inside a little, it's inside a little box, right?
Totally.
No, you got to see. Oh no, I don't understand why everyone doesn't have scribes. It's insane to me. Um,
So scribes
all
is
right, I'm
one
going to
thing.
give you
What
an.
are some of the other things
Yep, just
that you
keep
think
going.
that what are some of the other things that would be top level things that they're burnt out, exhausted, considering scaling back or quitting medicine? What
Yep.
can pediatricians do to make their lives easier and their practice more fulfilling right now?
All right, I'm going to give you. I'm going to not give you the answer you were expecting, perhaps even we're hoping for. I'm going to give you a mildly crazy answer, but this was born out of some lessons I've learned or I've tried to interpret um, over the last couple months. And just recently, last week at the PMI event, I gave a lecture about this. And in the part of it was I had the beginning understanding of a lecture, and I told the audience while I was going through it, like I don't know how this ends because I haven't figured out how to conclude it. And I figured out how to conclude it while I was there on the stage and then maybe a little bit after. And I think I'm on to something. And I think it's related to what you're asking here. So I'm going to sound like a lunatic, but bear with me, all right? Are you familiar with what's known colloquially as the hero myth or the Hero with a Thousand Faces by Joseph Campbell? You ever heard of this? It's a book from
No.
the 50s. Okay,
Okay,
you
please.
probably have. Oh yeah, you probably have. Believe it or not, it just might come to you indirectly. So it was a book by a guy named Joseph Campbell in the 50s, who, in my very poor academic review of it, was he pointed out that in all these human cultures, there is an example of a repeated hero myth that has certain elements. So they line up remarkably well. They don't always line up perfectly, okay? But it's this concept of you have a reluctant hero who is forced into an adventure that they don't want to go to. That adventure forces them to leave their homes. When they leave their homes, they meet enemies and allies, and they get a mentor. They're confronted by an enormous challenge. They defeat that challenge and they return home with wisdom that then they share with their communities to improve their communities they return to. And the person who returns home is not the person who left, and the community they return to is not the community they left. Now, I just glossed over 5 million pages of PhD theses with this. All right. Okay. So let me put it into some context. The movie Star Wars, George Lucas deliberately said, I am using the story of Luke Skywalker is Joseph Campbell. He had Joseph Campbell
Mm.
come to his movie set. I mean, this is very well known. But think of every little adventure. Think of Harry Potter. Think of Bilbo Baggins. Think of Hermione. Think of Dorothy. Think of the story of Jesus. These are all people who were reluctant heroes who had to leave the comforts of their existence and confront an enormous challenge and then return home. Now, there's pretty massive academic debate about the validity of all this, but when you hear some of it, you will recognize, wow, there are patterns over and over and over again that exist in our cultures to explain how we grow as individuals. Now, in the what I was thinking about, or when I was giving this lecture, I wanted to point out it's very easy for someone like me. I'm a vendor, I'm a consultant. I'm not a pediatrician. It's really easy for me to stand up on a stage and say, "Oh, you guys are my heroes." It's a big cliche, and I wasn't going to do that. That's really not the point I want to impart here. What I want you to think about, though, okay, let's see if I can articulate this properly. So I presume you read Harry Potter like
Sure.
the rest of the world,
Of
okay?
course.
And certainly every pediatrician is very familiar with Harry Potter. If you like the 1% of you who didn't read it are surrounded by those who did, okay? And you know all about it. So in Harry Potter, you read the books, and the goal of so many stories like this is you identify with that person.
Hmm.
Most people identify with Harry. Maybe you identify a little bit with Ron. Maybe you identify with Hermione. But the point is, you are this special person in this narrative, this world context. You are this hero in this context. Okay, because we all want to be a little bit Harry Potter. Don't we all want to learn that we were actually magic, that we were born, that we have some intrinsic thing that we didn't recognize that suddenly makes us special? I mean, that's, we all feel that, right? So here's the thing: over the last 2 years, very few pediatricians have felt or understood what they've accomplished. You and I have already named a couple today, like telemedicine, crazy E&Ms. You've learned how to do vaccine clinics and COVID vaccines. Like, the amount of personal growth that every pediatrician has gone through in the last 2 years is insane.
Sure.
And I mean, if your professional development could be measured on a growth chart, you would have gone from the 40th percentile to the 99th percentile. You all just grew 6 inches on the door frame in 2
Right.
years.
Oh, for sure.
But you don't think about it. You haven't recognized it. You haven't. So right now, all right, right now, as tired as you are and as disappointed as you are and as exhausted as you are, if something else came along, something weird and crazy, some new rule, you would all handle that with an organization and grace that you could have never delivered on in early 2020 or 2019.
Very true.
You are already all so much better than you realize. And here's the thing. Just like in Joseph Campbell's A Thousand Faces, the person, the hero, changes. That's a key element to this. That person changes, is not the same person. Bilbo Baggins, the moment Bilbo Baggins takes Sting and stabs that first orc, he is never going to be the same again. Everything changes about him. The first time Harry Potter sees magic, he knows that his world is never going to be the same again. That he's never going to be the same again. But notice how I just said that his world is never going to be the same. We can't return to pre-COVID.
Right.
So not only is this somewhat nostalgic desire to go back to the way things were, not only is that impossible because that place doesn't exist anymore, the person you were 2 years ago doesn't exist anymore. You are different, and you are better, and you are more capable than you ever actually planned on being. It just is. And so I know the purpose of your podcast is to actually identify those practical and pragmatic things. You and I have talked about these things over the years. Yes, a scribe would be right at the top of my list. Think about that, or go through the technology that can help you and hire better. And I have a long list of things. Get your prices right. Do your marketing properly. Go sit in your exam room and look around, like what smells or what doesn't sound right or what doesn't look right. There are all these things you can fix. Those are all true. But do you realize that all of these things that didn't have the inertia to fix 2 years ago, that were just sort of slowly driving you crazy, you right now have the strength to walk in your office tomorrow and say, I'm firing him, or we are dropping this insurance plan, or we're going to start doing recall tomorrow, or guess what? Screw it. Let's add a second office. It doesn't like those changes are nothing now.
Oh, for sure. I think that's what everyone has learned is you can figure this shit out, because before you could just say, well, this isn't the way it's always been done, which just, I'm sitting where I am today because crazy. I just couldn't stand that phrase. This is how it's always been done. But whether or not you subscribe to that, it doesn't matter, because the past 2 years have showed us that the way it has been done didn't work anymore. And so we don't have to go back to the way it's been done for the past 60 years. We can just move forward. But I think I like what you said there too about kind of the self-reflection that goes along with, gosh, I am quite a different person. And when the hiccups come up, I've had a lot of experience in the past 2 years with hiccups, and we've figured it out and we're still standing. And so, I love that perspective of just, new things are going to come up, and what about COVID-24? Gosh, but we've been through all that, and we know what to do, and we figured out what to do. Like the concept of doing a drive-through flu clinic is insane in 2016, But now it's
Right.
like, oh, well, let's get
You're
our
like,
tents out. Like, let's, bring our
we know
laptops
how
and the
to do it.
fridge out. Right. We know how to do those things.
That's exactly it. So when you ask me that question, yes, of course, there are some things we can target, but I'm going to say start by recognizing how different you are today and how there's nothing that's off the table anymore.
Right.
Nothing. And you are the person in charge of your reality, no one else. And so I just in 2019, getting a scribe wasn't the panacea to how your practice needs to work.
Right.
It might have felt like that for a couple people, and it was a huge boon, but that wasn't it. And what 2020 and 2021 allowed us to do was focus on the real root sources of why we do what we do, what causes us pain, and what gives us pleasure. And that's what you should be focusing on. You're capable of doing anything. And right now, all right, in my zombie apocalypse world, all right, I'm grabbing some pediatricians because we need we need them. And so I did conclude my talk. All right, said the problem I have with talking about the hero with 1,000 faces is I'm not standing in front of pediatricians to say, look, you're each heroes of your own story. Even though you are, that's not my message. My message is it's not a hero of 1,000 faces. It's 1,000 heroes with a very similar face. You all went through the same thing. And even though it might be different flavors, you all have a you all have a collective trauma. And we should be talking to each other about it now. And we should be sharing our success stories and sharing the places where we didn't succeed so we can avoid them in the future. It isn't happening. I want to be clear. I'm not trying to describe something that is actually in effect yet, but there is this enormous army of pediatricians who've done so much, and you just need to operate as a group,
Right.
and understand each other. And your influence is massive. And I hope you were able to get a glimpse of it during COVID.
Well,
There it is. That's my answer.
I think that's totally true. And the thing that I'll add to that too, which you had spoken to earlier, is that everybody's been doing it in their own silos. And how we do a flu vaccine clinic drive-through. Well, let's figure it out. And then the people, 2 miles over are figuring it out too. And the ones 200
Right.
miles over are figuring it out too. And everybody's starting from scratch. But if like you have said, everybody has so many similarities and gone through so many similar things. If we could share that together, then we could all benefit from it going forward and not feel so isolated, alone. And I got to figure this out on my own, and I can't even,
Exactly.
ask other people to help me too. Competitors or people that are clearly not competitors because they're in California and I'm in Nebraska.
Right. And I'm going to say you don't have any competitors.
Right.
You don't. Even the people right there in your town. This idea that you're really competing with other pediatric practices, I don't think that's been less true in my career than it is right now. And this kind of, Paul Vincieri and I ran into this. That's how we would get 2,000 people on a webinar on a Thursday night in the middle of COVID. That's how we got 3,500 people in that forum. It's because everyone get out of your silo, and you don't have time to figure out the solutions to 20 things. Work on one or two, and then share what you learned with everyone else. And this collective is how we're going to survive.
Amen.
So that's my advice to people. And thank you. I want to just say thank you for having me here, because this is how I get to participate in that. So I appreciate it.
Your participation has made a huge difference to so many pediatricians. So I'll just echo the sentiments of many that have said it too, that you have done such great work in the pandemic to help pediatricians. And our conversation today has just been a pleasure. And I know that we could talk for hours more, but I know that this has been really valuable. And I'll put in the show notes where everybody can find you at PCC. And everything that you've done, speaks for itself. So just thank you so much, Chip, for your time and for your wisdom.
Well, thank you. Well, your questions were great, and I've got to tell you that you had your focus on the future, and which is where I feel like everyone should always be looking. What are we going to do next month, next year, 5 years? And that is that's the preventive care vision, right?
Oh,
What are
totally.
we doing next year? And so I I don't know how I fell into this career, but thank God I did because I totally believe in it. So thank you. I mean, like this is I'm not even trying to talk.
Yeah,
You are
this is just
asking perfect questions. It's easy.